Welcome to my health talks. I am Sao Joel of Cramp Eye and Medical Care Services, and I am the Action President of the Rotary Club Kalangala Ssese Islands 2025-2026. Have you ever heard of a slogan that goes Unite for Good? In other words, Unite for Good. Or have you ever heard of a slogan, one good act at a time? Those two things. You know, those are the two things that Rotary is looking and working up on in the year 2025-2026. Now, basing on that, and basing on the fact that I am a Musao. A Musao is a clinician or a doctor or whatever you may take, but someone who is a health worker. So basing on my classification as a health worker and basing on my love and action as a president of the Rotary Club, today I would like to talk upon one good project. This project is going to be at Kalangala Health Center Iv. It is manned by the Rotary Club of Kalangala Ssese Islands. We have talked about sickle cell most of our times. We have talked about how sickle cell comes. We have said that a person to have sickle cell, you must have been born with it. It means it is a genetic disease, and we have all agreed with that. And we are saying that the multiplication of sickle cell bases on the way we planned for ourselves. For example, we are saying that to prevent it to happen, we need to test people before they deliver children to see if someone is having a sickle cell trait, should not marry another person with a sickle cell trait. If someone is having a sickle cell disease, should not marry or deliver a child with a person with either a trait or a sickle cell disease. Basing on that, Kalangala Health Center Iv started a sickle cell clinic in 2015, March in the first place. Today, it is 2025. It means the clinic has worked for over 10 years, because it is 10 years and some months. It means from the time we started the clinic to the time we are now, we are in increment in terms of number, because we started with 2 patients, and as I speak now, we have 120 patients in the clinic who are actively in the clinic and getting the services. This clinic started in an eye clinic. So the place where the services are got, it is in the eye clinic. The eye clinic is a very small place, just one room, 6 meters, 4 meters. So 6 by 4, that's what we are having. So if you come around on a sickle cell clinic day, which is always a Tuesday, you realize that we have all that big congestion. And because of this congestion, the Rotary Club of Kalangala Ssese Islands, hand in hand with the community of Kalangala and all the well-wishers, we are planning to construct a sickle cell clinic. Now, this sickle cell clinic is going to be a 2-story building. That means it is having a ground floor and then 1 floor on top. So inside the sickle cell clinic, we are going to have a daycare, we are going to have clinical rooms, we are going to have ultrasound scan room, we are going to have a mini lab, we are going to have a library, we are going to have a tea room, we are going to have, you know, the restrooms, all are going to be within. My coming in today, I'm requesting each and every person who is watching me today to join us. Join the struggle of the Rotary Club of Kalangala Ssese Islands to raise the funds that can manage to construct a standard sickle cell building. building is estimated at $200,000. We believe if we do one good act at a time, just that, together, we can get this done. Thank you very much, and I would request all of you to follow us and also to use the numbers which you can see on the screen and the email to consult and talk more about this. Please be involved. Together we can make it. Thank you.